That's under their charge. When I was here, I was in charge of volleyball, men's basketball, cheerleading, and dance. So I had quite a few athletes that were under my care, and concussions were something we had to deal with quite a bit. So we'll talk to you guys a little bit about what we did here at PC and the general management when it comes to concussions, because it's a pretty serious thing. And my point of view is that if there's ever a time to manage something conservatively, it is with a concussion. Something, sprained ankle or any kind of musculoskeletal injury, maybe I'll push a little bit. With a concussion, I go pretty slow, and I am extremely conservative, much to the chagrin of some coaches. Honestly, I don't care. You know, I'm in charge of the well-being of the athlete, and that's, you know, I'll go head-to-head with a coach if I have to be extra conservative when it comes to a concussion. And there we go. What is it? And I'm asking you guys, what is a concussion? You guys talked about it. What is it? Nobody knows. Jordan, what do you got?
It's any jolt, bang to the head that causes sensation, loss of consciousness, or non-loss.
And it used to be years ago, that was the diagnostic criteria for concussion, was being knocked out. If you weren't knocked out, you didn't have a concussion. And thankfully, that has changed dramatically over the years. But yeah, when I went through school, that was kind of what we were told. If the person was knocked out unconscious, that is a concussion. Otherwise, put him back in. And that's kind of where the NFL is getting a little bit of trouble now in terms of their management over years past. WebMD, traumatic brain injury that caused by a blow to the head. And that pretty much is it. I mean, concussions are very complicated, but that's a pretty simple definition. The TBI, traumatic brain injury. It can be a hit to the body, because it doesn't have to be a hit to the head. I can hit Jordan really, really hard in the body and give her a concussion. And it's the jolt that gives it. You know, the concussion, or your brain's like in an egg, right? It's like in an eggshell, it kind of sloshes around a little bit. But if I hit the body hard enough, the brain's going to hit the skull, and you're going to get concussive type symptoms. It can be from a fall. Okay, fall from anything, really. You can get hit and fall on the field, and that can cause it. You get the backlash of the head off the turf. Any injury that jars or shakes the brain inside the skull, like I said, is like an egg. Okay, it's like an egg in there, and it moves around. Maybe not as much as an egg, but that's what you want to think about, or kind of think of the brain and the head as an egg and an eggshell. And if you hit an egg hard enough, it breaks. Doesn't have to be a major hit. You can get a concussion from a very subtle hit. You can get micro traumas, and that's kind of where some research is heading right now, is that micro traumas built up over a course of time, over a course of a couple of years, can result into a quote-unquote big trauma and have significant issues. You have these athletes who, let's take football, lacrosse, ice hockey, you know, those kind of athletes where they're constantly hitting every single time. They may not have a concussion after every hit, but build up over time, those little things can be a big thing. So there's some research going into that right now. But it doesn't have to be a major hit. It can be something relatively small. Linear types of hits, forward to backwards, hitting straight ahead. Rotational, you can get hit in the head, kind of like a cross. You know, if someone's punching you in the face, or you get hit in the head and your head turns. Again, it's an egg. The brain's moving inside there. You can get damage to the side of the head. Side of the brain. I know you guys are writing, so if you want me to slow down, let me go. There you go. There's your egg, and there's your eggshell. You get hit, bang, inertia. Brain hits the front, and the recoil, sometimes the brain can hit the back too, and then you go boom right there. Bleeding, brain trauma, that kind of stuff. If it's rotational, like I said, the head turns and the brain turns inside that, and it can hit either side. Oh, I have a video. You can't have a concussion talk without seeing some concussion hits. And if anybody has questions or anything about any of the stuff, let me know. Hang on one second. Okay, we'll just make this as difficult as possible. Well, you get no volume. You get volume for this. Two of them, the hitter and the hittee. Sometimes you can get hit so hard and get a concussion so badly it puts you into a seizure. You start posturing. You ever see the arms go up in the air if someone ever get hit? Watch it. Ooh, right on the knee. That's a problem. Ooh. Posturing. See it? That's a seizure. There's a good shot of not even hitting the head, hitting the body on the other USC player. Just hit him right in the chest. So because of all those incidents, because of hits like that, a lot of the rules have changed in sports, especially football. You can't target somebody anymore. You can't hit him head-to-head contact anymore. If the helmet comes off on a player, the player has to come out for a play to get checked by somebody. Other rules, you can't hit as much in college football practices anymore. They're limited to the amount of time. This goes all the way down to Pee Wee football, where you can't hit any more than three yards apart in practice. High school football, it varies from state to state, but a lot of stuff has changed because of these concussions and the incidence of injury. And I know you guys saw some stats that concussions appear to be on the rise in terms of statistically, but I don't know if that's really true. I don't know if it's on the rise or if we're just getting better at spotting them. So I think, honestly, I think we're just getting better at spotting them. We're not letting people get away with saying they have a headache and going back into practice. Someone got a headache and one of my athletes, they're out. And I think we're just getting better at spotting them. What are symptoms? You can't answer this. What are symptoms of a concussion? Go ahead. Just say. Disorientation, big time disorientation. If the hit's hard enough, you know, if they can get pretty disoriented. What else? Nausea, big one. Nausea is kind of my red flag. If someone's getting hit in the head and they feel like they're going to throw up, they go to the ER. That means something significant happened. What else? Headaches. Headaches is probably the most common one. And in my professional opinion, if I suspect a concussion and you only have a headache, that is enough for me to keep you out of the game, practice, or whatever is going on, lift, whatever it may be. The headache is probably the most common one. What else? Big one. Lack of concentration is an absolute big one. How do you treat a concussion? Someone's got a concussion, how do you treat them? Keep them out. Keep them out of what? Everything, including class. Concentration is a big one. There is return to play protocols and there's return to learn protocols. Brain is like anything else. If it's injured, you have to give it rest. If you sprain your ankle, you got to rest it. You pull a quad, you got to rest it. You get a concussion, you got to rest it, and that includes class. Because if you go to class and you're straining cognitively, you're not giving the brain enough time to rest and recover. A, you're going to crap out in class. You're not going to do very well in class anyway. And B, you're just prolonging the recovery of that concussion. Going to class can bring on more concussive symptoms. That can absolutely happen. What else? Big one. Sensitivity to light and noise. Yep. Yep. Oh. Jordan. Jordan's one of my athletes, probably one of my favorite athletes of all time. And she got a concussion when she was a freshman. And I'm not sure how it happened. If you ask her, she doesn't know how it happened. But Jordan's a pretty highly strung out kid. She wants to excel in everything, playing and school. And she got a concussion. And I told her she can't do either one. Of course, the waterworks came on and she's crying. I didn't know if she was I didn't know her that well at the time. I didn't know if she was a crier or if this was something going on with concussion. This went on for like 2 months. It went on quite a while. Got to the point where we're like, all right, you need to go see the psychologist because I don't know what the hell your deal is. I don't know what's going on. It never really dawned on me that it could be the concussion bringing on such an emotional thing because she was getting emotional. I mean, you cried in my office for weeks, yeah. Yeah, pretty much. But it was the concussive symptoms. We went through, full workup and everything, and it was her concussion that was causing. It was lingering. The symptoms were lingering, and it never really dawned on me. I just thought she was an emotional female. I'm a guy. I don't know, an emotional female. I just thought that's what it was. But it turned out it was her concussive symptoms. So emotion is one that I talk about quite often when it comes to that because it never really dawned on me before. But emotional, I don't want to say inappropriate, maybe exaggerated. Definitely. Love you, kid, but Jesus. All right, what else? So no one did say fatigue, but fatigue, yep. There's one other big one. Memory, yeah, memory. I wasn't thinking that one, but memory is a big one. This one's more physical than anything else. Balance. Balance is big. Balance is probably the symptom that goes away the slowest and is the one that we check most religiously because they can be completely fine on their cognitive test, completely fine on their symptom test, and if their balance sucks, they're still out. And balance is usually the slowest to come back. I had a basketball guy when you guys were still in high school. He had it was my first year with basketball, and probably his third or fourth concussion. And we kept him out for 2 months because he kept having symptoms. 3 weeks of that was just getting his balance back. He didn't have any symptoms. His cognitive skills were all fine. He was back in class. But I still kept him out because he couldn't stand on one foot without completely falling over. So balance is another big one. Headache, dizzy, we didn't say dizzy, but dizzy is a good one. Sensitive to light and noise, balance issues, huge. Feeling out of it, just feeling out of it. And you can tell that when you look at them, they just feel out of it. They're not all there. Emotional. Sleeping issues, not able to sleep at night. It's in a wives' tale that you have to wake them up every 20 minutes. You don't have to do that. But sleep disturbances are did you have sleep disturbances? Yeah, you kind of did the whole. You never really did sleep very well. What else? Trouble concentrating. We talked about that. Some stats. You guys saw some stats. The American Association of Neurosurgeons: 300,000 plus related concussions annually. Likelihood 119% per year play. 62,000 in high school. College football players report 35% have had one. 20% have had multiple concussions. Between 4 and 20% of all college and high school football players have had them. And the risk is 3 to 6 times higher for someone who's got a past medical history of a concussion. If you have a concussion, you're very likely to have another one. And the likelihood of it is so great that it's probably not even going to take that much of a hit to get one. It could just be a ball in the face. Could be just be a slight body check or whatever it may be. Soccer. Soccer has a lot of concussions. Believe it or not, soccer's got a lot of concussions. A lot of contact in soccer, a lot of heading the ball. Risk for soccer and football is very similar. Cheerleading, I had dance, I had volleyball, and I had basketball. And guess which one had the most concussions every year? Every year. All the time. Cheerleading. They love to drop them. I don't know why. They just can't catch them, but they drop them. And cheerleaders, every time, not every time, every year I probably had 4 or 5 concussions on that team every year. Yeah. So what do we do? NCAA requirements. They require us to have a concussion management plan. Okay, if someone gets their bell rung, we have to have a plan in place, written and documented, and follow the protocol to handle that concussion. Okay, PC has one. Every school in the NCAA has to have one. High schools are starting to get it now. Professional sports definitely have one. Usually they're league-wide, and they're pretty standard. First step is to inform the student-athlete of the policy. This is what's going to happen. I have them sign a piece of paper every year saying if you get dinged up or you have any of these symptoms, I'm keeping you out. And they cannot come back and say, you never told me this was going to happen. It's more of a legality issue at that point, but it's also to inform them that we have their back. When I tell parents about our concussion policy, they love that. They love knowing that their kids are being looked after when it comes to a very serious injury like this. So first step, inform them. Baseline testing. You guys talked about baseline testing before. What did you guys talk about? Which tests? I know you guys probably talked about the SCAT, right? What other test? I don't know the Montreal one. You guys talk about it?
That was the cognitive test.
Oh, okay. Impact, you guys talk about impact? No? No impact? Impact's a computerized test. A lot of people use it because it is not paper and pencil. I don't need to give you the test. You just kind of sit in front of the computer and take the test. And it records their baseline information, kind of similar information. Well, we'll talk about it, actually. I have a thing for it. This is who we test. This is what the NCAA requires us to test. Okay, men's, women's basketball, diving, field hockey, ice hockey, lacrosse, men's lacrosse, not women's lacrosse, men's women's soccer, softball, and cheerleading. I don't know. Why not everyone? What do you think? Look at that list of sports. Think about all the other sports. Well, what sport do you not see up there, Jordan? Volleyball. Did I test volleyball? Yes, I completely agree with you. I tested volleyball and I tested dance too. Dance is not up there. But the NCAA, this is the minimum requirement. Doesn't mean you have to follow. It's just a guideline. But it's up to the person in charge of that team to do it. I agree with you. I did everybody. But it absolutely goes with the risk of injury. And these are just the sports we have here. Obviously, football would be on there, but these are just the sports we have here. Tests. Impact. Okay, so this is the impact test. It's all computerized, like I said. Preseason baseline testing, and then they have sideline apps for your phone, iPad, whatever it may be. It's pretty convenient. You can take it with you wherever you go. It's pretty easy to administer. It is not labor intensive by the staff. I don't have to sit, the SCAT, I have to sit down one-on-one with every athlete that I'm going to do. And at one point I had 100 athletes and I had to go through and do a SCAT baseline for every single one of them one-on-one. This one you don't have to. This one you can just sit them down in a full room of computers and say, okay, take your test, do your thing, okay? You do the test again once a concussion is suspected within 72 or 24 to 72 hours. Same test. Why do you do the same test? Yeah, if you're a dumb shit before and a dumb shit after, then we know. But if there's a change, then we also need to know that. So that's why you do the same test over again. And you complete the test to determine your return to play status. Once you get close to the baseline or at baseline, then you can go graduate into the graded exercise progression, which we'll talk about in a second. They get you back into play. And it kind of looks like that. Computer's almost an app. SCAT-3 is what we use here. It's a pen and paper test. It's nothing computerized, although the iPad does have an app for it. I don't like the app because it only gives you the results. It doesn't see on which questions you had a hard time with. It just says, okay, in section 2 you got whatever right, and so on and so forth. But it is a pen and paper test. I prefer to do it that way. It is way more time consuming than the impact because it'll take you weeks to do everybody. It is pretty comprehensive. It includes a balance test, whereas the impact does not include a balance test. And symptom checklist, balance test, cognitive testing, stuff like tell me the months of the year backwards. I give you a series of numbers. You tell me those numbers in reverse order, words, stuff like that. And then, like I said, there is a balance test. There is a sideline version of the SCAT, which is the Maddox test, which is essentially where are you, what's the score, what's going on, those kind of things. But it's, like I said, it's a little bit more. Examine symptoms, cognitive ability, coordination, balance. Oh yeah, coordination, you got to kind of do the drunk guy test on the side of the road, that kind of thing. It looks like that. And these are the people who sponsor, or not sponsor, but recognize at FIFA, the Olympics. I don't know what these are, probably the rugby thing from Europe. The NCAA doesn't tell you which test you have to use. The NCAA just says you have to have a test to test all this kind of stuff. More in the SCAT-3. It includes Glasgow Coma Scale, which is essentially me judging where you are in a coma scale. The lower score means you're more out of it than you should be. Maddox scale, this is your sideline assessment. Symptom checklist are 22 symptoms that range from everything you guys said and some stuff you didn't say. Your cognitive, list of words, number sequences, months of the year, okay. Neck exam, that was new as the SCAT-3. SCAT-2 didn't have that, but the neck evaluation, you have tightness or pain in their neck. That's also a consideration you have to have. BEST is your balance score, your balance test. And that is feet together. All your balance tests with your eyes closed. Why? You guys know why? Yeah, your eyes help you balance. Your eyes in your inner ear help you balance. If you take away one of them, you can really get a true sense of what your balance is like. So everything is with your eyes closed. Feet together, hands on your hips, eyes closed. Then you sit on your non-dominant leg. Then you put one foot in front of the other with the non-dominant leg in the back. Kind of stand like this. Everything with your eyes closed, holding for 20 seconds. Errors. Do you catch yourself? Are you going to fall? Any kind of shift in your hip or ankle? All that kind of stuff are errors. And very rarely in an athletic population, you're going to have everyone, or most of your athletes are going to have zero. Everyone's going to have an error. And so you keep track on your errors, you give them the test later on, and you compare the errors. Like I said, balance is one of the most important things to use. Coordination, again, sticking your right or left hand, doesn't matter which one, touching your finger to your nose. And then delayed recall, I'll give you a list of words in the beginning of the test. You repeat them back to me 3 times. Three times I give you a list of words. You repeat them back to me in any order, and then at the very last question on the test is, okay, what were those words? Any order you want. You'd be surprised how many people screw that up. And each athletic trainer has one of those. Okay. So we use the more time in consuming test as opposed to impact. Knowing what I just was talking to you guys. You guys have any idea why we wouldn't use impact? The computerized test versus the paper and paper test. There you go. Yeah. Yeah, the sensitivity, light, and noise, and the cognitive. If you're sitting there concentrating on a computer screen. When you have a concussion, we tell you no screen time. Don't use your computer, use your cell phone very, very little. But the impact test is kind of putting that person back into that situation. There's not a lot of cognitive rest when you take that test. You're testing them cognitively with the SCAT, no question. You're testing them cognitively with the impact, no question. But the difference between SCAT and impact and why we don't use it is that there's no concentration on the screen. You're not looking, you're not reading, you're not deciphering. You're just answering questions for me. So that's why we don't use it. That's why we use a more time-consuming test. But we have a large staff here. We have 8 athletic trainers. We have 300 and some odd athletes, which doesn't may sound like a lot, but it's really not that big. So we have the resources to be able to do that. Some of these high schools or some of the smaller D2 or D3 schools with only a couple athletic trainers, they have to do something that works. And impact is where they're making their money to do that. So that's why we use SCAT versus impact. After injury, here, assessment immediately after the episode is your Maddox and your alert and oriented times 4, meaning you're really, you know who you are, where you are, what's going on, and time of day. We immediately assess that kind of stuff, and we get the SCAT-3 going as soon as possible. Usually it is, if it's during a game, we get them right after the game. If it's during practice, we get them immediately as soon as it happens. But we get that SCAT-3 going immediately as soon as it happens. We document a clear mechanism of injury. What happened? How did it happen? That is very important for us in terms of understanding it. This is probably one of the most important aspects of the whole assessment. Past medical history. Have you had a concussion before? Now what's going on when incoming athletes come in and we fill out a health history form, if they say they've documented a concussion In high school, we do a significant more neurocognitive testing on them to see where they're at, and there's a reason why. A couple of years ago, we had a freshman soccer player come in. In her senior year, during the season, she got a concussion, had concussive symptoms all through the rest of her senior year. Graduated with no problem, was recruited by us, offered a scholarship, accepted it, and came here. Cleared by a neurologist to begin soccer practice, didn't do any kind of training over the summer, couldn't. She had concussion symptoms. 2 weeks before she got here to start, and in the beginning of August, she was cleared by a neurologist saying, you're good to go. No problem, full practice, go. 10 minutes into her first practice of the first day, she hit the ball, had a concussion. First day. Had concussive symptoms. Wasn't that big of a deal. Just doing warm-up drills. Had the ball, had concussive symptoms. We found out that this was probably her 4th or 5th concussion in a 3-year period, and we DQ'd her. Cancel everything, you're not playing for us anymore. So documenting of the past medical history is a big thing. It also would dictate to me how conservative I need to be with a concussion. Jordan came to me today and said, I have a concussion. I remember, oh shit, she had a pretty significant one. As a freshman, I'm going to take it really slow. It may have taken us a month to get her back. This time it may take 2 months to get her back. And that is dictated by the past medical history. Because once you have one, you're more likely to have one, and the more likely the damage is going to be recurring and long-term down the line. So past medical history is an absolute must. Notify team doc. Dr. Perini is our head team physician here. We notify him and get him involved as soon as possible. Usually it's just a phone call or text message, hey, someone's got a concussion, and he says, okay, go through the protocol, and let me see him in clinic the next day or whenever he's on campus. So we'll get the team doc involved. Speak with a roommate and res life. Okay, why would we want to talk to these people? Alana, why would I want to call you if Jordan go boom again?
Because you would want to see if she's
Yeah. Jordan may not be the most objective in terms of assessing how she's feeling. Alana may notice, oh man, she is. And I've gotten phone calls. I've gotten messages from people about you. I haven't told you that, but I have. But we do that because I'm not with her. Alana's with her, or I'm not with that athlete. The roommate is. Res Life is with them. Not necessarily with them, but if there's a problem, they need to know. If I send someone to the dorm with a concussion, I call the head of Res Life, and the Res Life tells the RA and say, hey, you got X, Y, and Z, he's got a concussion. Okay, you need to keep an eye on him. Maybe they go check on him a little bit more. They're more cognizant of what's going on. If something's going on, then they activate EMS and get them going, or call me or whatever, and I do it. So we talk to these people here because they're our eyes and ears when they're not with us, when the athlete's not with me. Encourage cognitive rest. So we get our OAS department involved, Office of Academic Services. They will contact professors and arrange as best they can cognitive rest. Okay, explain to them what is going on to professors so they take it easy on them and give them extra time or whatever they may need later on once they can return to the classroom. No screen time. We try to limit screen time as much as possible. We can't take their cell phones or their computers away, but we say, hey, look, this is why you can't do that. Whether or not they're listening is up to them. I'm guessing probably not a very high compliance with that because we're all addicted to our computers and our cell phones. But we do it the best we can. And then a daily SCAT assessment. Every day they come in, they at least do a symptom checklist to see where they're at. I may not do a full SCAT on them because I don't want them memorizing the questions. But I would do the symptoms to see where they're at, engage them. The symptoms are on a scale 1 to like 6 or something like that. And daily, circle the number where you're at, and I can see if they're getting better, if they're getting worse. But that's essential. And then weekly clinic visits with our team doc. He comes in weekly on Wednesdays or Thursdays and just a weekly check-in to see where they're going. Luckily, our docs are pretty conservative when it comes to concussion as well, as they should be. And then consider referral. If the symptoms are getting worse, then we do have to get the neurologist involved. Do we have to get a CT or an MRI of the brain to see if there's any kind of significant damage going on? That rarely happens because usually with the rest, cognitive and physical rest, they tend to get better, but there are occasions where they don't get better or they get worse. Second impact, I don't know if you guys ever heard of second impact. That's, you start to feel better and all of a sudden you start feeling really crappy again. That's why, again, we have the roommates and Res Life involved. They can spot that kind of stuff. If you start getting worse after the concussive hit, not getting better, staying the same and getting better is what we want, usually what happens, but if they start getting worse, then we have to consider some other stuff. And then a graded exercise program to get them back into activity, and that's starts off very, very simple with a bike exercises. Why do you think we want to do this? A graded exercise program. Start on bike, and then we go sprint bike, and sport-specific stuff, and I don't remember what the rest of it is, but go ahead, Jordan.
To heart rate, how your brain.
Yeah, that's why.
responds.
Your symptoms are going to get worse when the blood pressure goes up if you're not ready to do that. Getting the blood going with the heart or with a bike or something like that. It's a 20-minute bike session. It's not very hard. You just get on and pedal. And if that little bit of blood pressure increase affects you or gets you more or brings out more symptoms, then we know, okay, we're not ready for that point yet. We're going back to rest. And we'll try again in a couple of days and see if that works. And then from bike, we go to sprinting, to sport-specific, to non-contact practice, and then get them right back into practice. It can take a week. It can take a week of feeling no symptoms at all for me to release you to go back to practice. And it's a joint decision between the athletic trainer and the doc. There has been times when the doc has cleared somebody to go back in, and I said, no, we're not yet. I don't feel comfortable with it. Like I said, I'm super conservative when it comes to concussion. But it's a joint decision between he and I as to whether or not they go back into practice. If an ED visit is needed, emergency department, Rhode Island Hospital is who we use. And that's because they have a neurosurgeon. We don't use any other hospital in the state because they don't have a neurosurgeon on call. Rhode Island Hospital has a neurosurgeon on call, and if they have a concussion or some sort of brain injury and they need to see a doc, that's where they go. We have the team physician know that we're sending them, and then a follow-up with the team physician after the ER visit. If you go to ER with a concussion, they're going to give you a CAT scan, see if there's any kind of brain bleeding. Usually there's not, although sometimes there is. And we follow up with the team doc afterwards. So these are instructions that we give to, who do we give this to? This is to the athlete. So student athletes suspected of head injuries must follow the instructions below and give the bottom half of the sheet to your roommate, RA, or whoever will be with you next 24 hours. Sometimes parents are involved. Do not take any aspirin, Tylenol, Advil, Aleve, or any other pain medication. And that's because we don't want the symptoms to be masked. If you have a headache, I want to know. And that's probably one of the hardest things to tell a student athlete if they have a concussion, their head hurts. Don't take anything. You're like, what the hell are you talking about? What do you mean I can't take anything? You have to explain to them why you're going to be in agony for the next 24 to 48 hours. You're going to have a killer headache and you can't take anything. I've been cussed out a couple times because of it, but it's what we need to do. It's what needs to happen. And it's all because we have to monitor the symptoms. If your headache worsens, it becomes nauseous, dizzy, change of personality, memory loss, call EMTs immediately. This is the security number on campus. Call them up. The campus does have EMTs who are on call. I think they're stationed down in the health center. EMTs come, do an evaluation. They call rescue, Providence Rescue, and they take you to Rhode Island Hospital. They have specific instructions to take you to Rhode Island Hospital. And then they call me or whoever else. John Rocks was my boss. He's the head guy here, athletic trainer here, and that's his cell phone number. And do not participate in any physical, mental, cognitive activity until you're evaluated by the team physician. Again, we try to limit that cognitive piece as much as we possibly can. And we just tell them, report here at the time. So these are roommates' instructions for a concussed athlete. Kind of gives you the rundown of what it is. Fill in the name, date, all that stuff. And this is also important because if we give this to the RA or the roommate, and they have to call rescue, they can give them this. They have a little bit of history of what's going on. If Jordan or whoever has a concussion is unconscious, they can't give a history. So this kind of gives them a little bit of a history for the EMTs when they come to pick you up. Symptoms to look for. We'll ring them, write them out for them so you can see what exactly to be cognizant of. Again, if any of these happen, call 2222, Rhode Island Hospital, and take the athlete there. And just little instructions, keep the athlete warm, lying down, quiet. Why? Why lying down, you think? Why not sitting up? In case they pass out, yeah. If they've been in a chair and they pass out, now they hit their head again because they're on the floor. So we try to keep them in a position where if they pass out, it won't be really a big deal. And again, avoid any kind of Tylenol, Advil, aspirin, whatever it may be. Yeah. So this is our graded exercise program back to return to play. You complete these once the student athletes reach 95% of their baseline scores. I like to go 100%. You cannot have any symptoms before I put you in a graded exercise program. You have to be all zeros down the symptom checklist. Your cognitive ability has to be good, and your balance has to be pretty much what it was. So first step, 20-minute bike workout, speed 10 to 14 RPMs or miles per hour, and that's not even that fast. You know, it's a decent clip, but you're not sprinting, that's for sure. And what I do is I Okay, so the day before this happens, you have to be all zeros and perfectly fine. And then as soon as you come in the next day, okay, get on the bike, get going, get that blood pressure going, and then I give them another scat after that to see if the blood pressure increase has changed their symptoms or their abilities to concentrate at all. If it has, then they stay at step 1, or if it's really bad, I take them completely off the bike for a couple more days. Step 2 is a bike sprint workout. We have a bike down in the training room where you can sprint on it, 30 seconds on, 30 seconds off, 10. And you just go out as hard as you can. Again, get that blood pressure. If the minimal blood pressure doesn't do anything, let's get the blood pressure way up and see what happens there. And again, they come in, they get on the bike, they do the thing. Then I give them the scan afterwards and see what it is. And if they have symptoms, they stay at step 2 until the symptoms are gone. They can do a body weight circuit as well, 3 sets of 20 seconds, as many as you can. Squats, push-ups, sit-ups. Again, try to get that blood pressure up. Sport-specific drills. This is when they get into, not in practice yet, they're doing sport-specific stuff. If it's basketball, they're doing dribbling, shooting, rebounding, that kind of stuff. If it's volleyball, they're setting, they're hitting, they're moving side to side, jumping, that kind of, whatever sport-specific drill you can come up with for that specific sport. And then step 4 is a non-contact practice. They go in, there's no hitting. If there's any kind of hitting involved, they're out. They're out of that particular drill. And for basketball, what they do is they put a jersey on, like Dunn was non-contact because of his shoulder. They put him on a red jersey on for practice. So they knew not to hit him, but they could go through the drills and whatnot. And they say, again, I do the scat afterwards. Usually by the time they get to this point right here, the scats have been all normal and they're starting to feel good and everything's going really well. I'm just concerned about symptoms at this point, and then return to full play. But this just 5 steps, right? 1, 2, 3, 4, 5. And this can take a week. Okay? Student athletes may progress to the next step if they complete this step with no symptoms. I don't like to do that in the 24-hour period. Students may not complete more than 2 steps in the 24-hour period. For me, it's 1 step a day. 1 step a day. And again, go real slow. And there's got to be 24 hours between 4 and 5 between a non-contact practice and a full play practice. They can't go non-contact practice, feel good, and then all of a sudden we switch it to full contact. There's got to be a day in between. Yeah, and progression is going to vary greatly depending on the concussion. It can take a week. It can take 10 days. It takes as long as it takes. Coaches understand that. It takes as long as it takes. And I guess that's it. That's the end of the power. You guys hear what's going on in Boston right now? Boston just passed a law, actually, which is a very bizarre law, but they passed a law. And let's see if I have it here. There it is right there. This was back in September. They passed the law. What the heck? This is not what's on my screen. Okay. They passed a law, and the law for the city of Boston, not for the state of Massachusetts, for the city of Boston, outlines exactly what healthcare providers need to be on the sideline to handle concussion for all Division I men's ice hockey, football, collision-type sports. It's the first city to do it. It's a city thing. It's the first city to do that. You guys hear what happened in Michigan? The quarterback? Yeah, what did you guys hear about that? You saw it? Oh, okay, so you saw, yeah, okay. Big time mess up there. Big time mess up there. It could eventually cost the coach's job, and the athletic director's already out. He lost his job a couple weeks ago. And the big problem there was complete lack of communication between the athletic training staff and the coaching staff. There was a neurologist in the stands, apparently, and he was trying to get down to the field, and before he could get there, whoever put the quarterback back in. I can't imagine the athletic trainer put the quarterback in because he was so obviously concussed. I'm hoping that it was one of the coaches did it. I can't imagine the athletic trainer would put somebody back in. I mean, he could barely walk off the field as it is. But the law in Boston kind of dictates that neurologist that was in the stands in Michigan needs to be on the sideline. Actually, they call it a traumatic concussion expert. And whatever that person may be, I don't know, is it the athletic trainer? Is it a neurologist? Is it your family practice doc? Our family practice doc handles all of our concussion stuff here. But I just thought it was kind of odd that it's just the city of Boston. It's not statewide, and it's the only city in the country that I know of that does that. A lot of rules have been changed with concussions for the high school kids, NCAA, obviously we're just talking about that, and league-wide for the professional leagues, baseball, hockey, whatever. And to me, the Boston thing is kind of overkill. NCAA has a mandate and rules in place to handle that kind of stuff. And why, in my opinion, I think it's just politicians trying to get votes. It was September, the midterms were, in November. I think it was just politicians trying to overregulate something that the people already do. But whatever it may be, Boston's got that law now, which is, in my opinion, kind of odd. But that's how we handle concussions here, and it's pretty much standard. Not standard, but it's school to school is going to be pretty similar to what it is. One of the things that schools are now doing is laying out the return to learn protocol. There's been a lot more research over the last year, actually, with the return to learn, and PC may have one. We may have one now. I don't know. I haven't been here for a while now. So, but it's going to look similar to what the return to play protocol is. Once we get kind of more hard data on what we need to do in terms of return to learn, they will finalize and get a formal protocol in place. Let's see. What, you guys got questions? Threw a lot of stuff at you. Go ahead.
I have a friend who in February 2 months sustained 3 concussions.
Holy crap.
Yeah.
Someone screwed that up.
He plays a sport, but he wasn't playing at the time.
Yep.
And they were non-sport related concussions.
Is there a difference? Concussion's a concussion. Go ahead. Sorry. Go ahead.
Yeah, but so he didn't play. He plays baseball. He didn't play.
Okay.
And symptoms went away. And then in September, they just resurfaced again. That's what we're talking about.
Second impact. Second impact doesn't usually. It doesn't. This is really annoying. It doesn't really. Second impact is more closely related to the incidence of injury. What I'm thinking is happening is that he never really healed from the. He had 3 concussions in a month.
Yeah. And then, so in September, he started to have really severe symptoms.
Yeah.
And still could not concentrate for more than 5 minutes.
Yeah, that's a problem. If I had an athlete who had 3 concussions in a month, first of all, I'd probably be fired. Second of all, they would be done probably a year. Like, I would go big time, hugely conservative, because the long-term effects. I mean, you guys heard about depression, Alzheimer's, all that kind of stuff, right? With long-term effects of concussion, and I'm not sure if the concussion causes that or if it just makes them symptoms. They're more likely. The concussions are bringing those symptoms out earlier or more severe. I don't know. There's not a lot of research with that, and I think that's kind of the questions we need to start asking. Is not necessarily if concussions cause it, depression or whatever it may be, if they were already predisposed to depression and the concussions are just bringing it out more. Anyway, but regardless, there's a long-term effect in concussion. 3 in 1 month is, the first one didn't heal. They didn't have enough time between the first and second, or the second or third, and he would be done for quite a while. Second impact is more along the lines of you get a concussion and you feel okay. You got a concussion, you got a headache, maybe a little dizzy or whatever, and you go home and you come back and you feel the same way, but then 2 days later, all of a sudden you start throwing up. That's kind of more what the criteria of second impact is. Your friend, he didn't heal. He just didn't heal, and you try to do too much too soon. And that's pretty. How do you get the first one? Mm-hmm.
Wiped out. And then the second one was 6 days later.
UDI, unidentified drunken injury.
And I forgot how the third one.
I bet you it's all from the first one. It has to be. 3 in a month, that's a lot. And there's probably no way that they healed from the first one. And it just, bad. That's bad. What, is he in school?
Yeah, he's in school. He's taking 2 classes. He's obviously not the full course. He's in a study in Boston. So he goes to Wesleyan.
Uh-huh.
So he's been commuting twice a week to go study. And I think on Wednesday he has really bad symptoms. I mean, he can't do his homework.
Yeah.
What's
I don't even know why he's in
scary
school. Why is he
yeah,
even in school?
I don't know. And we had dinner on Monday, and he was like, "Yeah, I'll probably not play baseball." And I was like, "Probably." I was like, "You should not be playing baseball."
If he can't read without getting a headache, there's no way he's going to be able to sprint or bat or whatever it may be. Yeah, no, his career might be done. I mean, he may never recover from this. I mean, he'll recover from it, but he may not be able to the point where he's like, be able to compete. That's almost a DQ event right there. Wow. Someone's mismanaging that one. Anybody else? Go ahead.
So it's such an impact when I had a friend in high school who got
Yep.
playing soccer, and then unfortunately got like in the head during
Mm-hmm.
the class. It's like my period, I don't know if I'm recovered or not, but we do impact in our
Yep.
I don't know if it's done it. And
Is she really? Yeah. It didn't have time to heal. I mean, concussions are one of those things. I love to be able to tell you, bones heal from a fracture 6 to 8 weeks. I'd love to be able to tell a concussion, a grade 1 concussion, you recover in 2 weeks. It doesn't work that way. Well, she probably will, but I mean, it's going to take a long time. It'll take a while, and she's going to be way more predisposed to getting concussed again. Even like a slightest thing could send these symptoms back off again. It could, and it could not too. You don't really know. But I would definitely, between these two cases here, I mean, I would be really, really super conservative in terms of. I don't even know why your guy's in school. I wouldn't pull him out completely. Why waste a year? I mean, redshirt or something, come back in a year or two. But yeah, second impact is not usually associated with another incident. It's usually from one incident. Yeah, I don't really know. Concussion. I don't know. Yeah. Repeated concussion. Yeah, I don't know. It's serious. Yeah, it is serious. It is definitely serious. Go ahead. Mm-hmm. Mm-hmm. Like mask the symptoms and not be completely honest? Go ahead, Jordan.
You can't. It's impossible. Really. I tried it.
Tanking the test? Yeah. Right. Yeah. I've had people tank that test completely, but there's one test they cannot tank. They can't take the balance. The balance is the one you can't fake that one. I guess you could go in there and just start being all over the place and try it, but if you can't balance, you can't have that ability to balance, I'm not letting you play. That's probably the toughest one to be able to. Yeah, I mean, they can come in. When they do the baseline, all the symptoms, they should be zero. And I don't think I've ever seen one do this. But yeah, they can mess up the numbers, they can mess up the memory, and they can maybe tank the balance a little bit. But if you can't balance, I'm not letting you back in. I'm really not letting you back in. So, but yeah, there's that risk. There's absolutely that risk. Sure. I don't think my basketball guys are smart enough to think about that though. But and you can tell them I said that too. It's fine. What else? Go ahead. I do. I have it. Yeah, well, she's 8, so she'd tank it anyway.
Pretty awesome, though.
She is pretty awesome, though. I will give you that. She plays field hockey, she plays lacrosse, and she plays basketball. And I was saying before you guys came in, one of the most serious injuries I've ever seen was in field hockey. I had a player, you guys are probably in middle school at this point. We were at Holy Cross, and we were getting ready to play. It was a night game, and one of her teammates struck a ball and fouled through when it cracked her in the face. And fractured her zygomatic arch, or eye socket, the whole thing. Really screwed her up pretty good. I told one of these guys that if you take a piece of glass and drop it, that's what the x-ray looked like. The bones are all kind of smashed like that. So reconstructive surgery, plastic surgery involved, it was a pretty big deal. So I don't, I think about that for sure. I don't limit her in terms of the sports that she wants to play. She's not playing football. If I had a son, I might not let him play football. That'd be a tough decision because I played football through high school and through college. That'd be a tough one for me to swallow, but I'll let you know. But yeah, I'd be definitely proactive in terms of getting a baseline and being all up in her grill when it comes to all that kind of stuff and making sure she's okay. I only got one, so I gotta make sure I do it right the first time. She wouldn't want to do that. If she did, if she wanted, if I had another daughter, if Livy wanted, I can't imagine she'd want to cheerlead though. this off. If she wanted to cheerlead, I would be supportive of it. I can't imagine she'd be a flyer up in the air because my wife is 6 feet tall and I am 6'2". So she probably would not. My daughter right now is almost Jordan's height and she's 8, so she's pretty tall. So I guess cheerleading, I don't know. I don't drop anybody, babe. Yeah. Get kicked. They get kicked, absolutely. And dance team does the spin stuff that they do, and sometimes body parts hit other heads, you know, and it can be bad that way too. Yeah, then, yeah. What else? Sir, yes, go ahead. Go ahead. Who would monitor it?
I don't know. I'm not sure how it works.
Yeah.
It's like rugby.
I mean, rugby is, God, rugby should be outlawed. Do I think they should? Yeah, I do. There was, I think, was it one of your students last year?
Well, I was going to follow up and to comment.
Yeah.
In the spring, after
Yeah.
fall,
Yeah.
I was working with Brian. Had it Dr. Evans, Dr. and I met with that MD from City Health,
Yep.
Catherine
Kelleher, yep, the nurse.
and
Ed LaPre, she's the rec sports guy. Yeah, rocks in the ball.
met with them, trying to develop some kind of protocol and blood support in the murals. That was in March, I believe, that fall. They never got back to us on it. Just Dr. Evans, Dr. and I were concerned about kind of
Yeah.
lost in the cracks. because-
Right.
And, so I'm hoping to follow up.
Yeah, so do I think they should do it? Yes. I think the problem is that who's going to monitor it? You know, I guess maybe student health services would do it. And then who'd administer it? Right. Maybe, yeah, because I can't imagine, I know they don't have the staff to do the scat testing. So, yeah, you could just do it. And the other problem with doing the scat test is, okay, so you take the scat test in your dorm room and you're all by yourself and you do it. But then you take the scat test again and say you're in a computer lab or something. And there's people around you, distraction, and then you're going to take it there. You know what I mean? So the problem with impact testing is there's no consistent testing environment. Or there can be, but you have to trust that the athlete who's taking the test is going to put themselves in that environment. With the scat, they come in my office, shut the door, and we do it. Or one of the exam rooms and shut the door and do it. So the testing environment's the same. But yeah, I think there should. I think the problem is it's just who's going to monitor it, you know? I see these guys every day. You don't see, the student health doesn't see anybody unless they're hurt. You know what I mean? I think that's what they're trying to figure out. Yeah, as far as I know, there is not. And there should be. And I think definitely there should, especially with rugby. Damn sport needs to be outlawed. What else? Yo.
So in terms of relating, taking the lines of players, like saying that I heard Jamal Charles recently, still running a touchdown, and he said in his comments that I was sorry, and I was telling him that he was touchdown. In the NFL, I don't know whether it's got an impact on how you feel at that level, where ideally there's lots of monitoring stuff.
Right. Hide behind the league, I think, because the league has a policy league-wide, and once they enter into the concussion protocol for the league, then they kind of go. I mean, the whole problem is the athlete reporting the symptoms, and it's a lot of times it requires athletes to say, you know what, I don't feel right. I got hit and I have a headache, But I mean, you could see them, but they can hide it. I mean, that's the problem with concussion assessment and concussion management. Some of it's subjective. It's really subjective. But the league level, there is a protocol they get into, and they go through all the steps and see all this stuff like this. But it kind of revolves around the athlete coming forward and saying something about it. Unfortunately, have more control over you guys. Mm-hmm.
Well, yeah. The balance is so.
The balance is tough, but someone like Jordan, how many girls are on your team? 12, 20, 17, geez, big roster. If I'm out of practice and I can tell Jordan's not setting properly or she's not moving right or something, she's just off, I can spot that. Football team's got 53 on the NFL team, not counting practice players. College has got over 100. That's tough to monitor. And you have 3 people or whoever working the team, that's tough. That's a lot tougher. There's more stuff falls through the cracks. But with her team or basketball team, something like that, with small numbers, I can spot that. You know, I know her well enough to be able to see that. I know Buckets well enough to know that if he's shooting righty as opposed to lefty, that something's wrong. You know, so I can pick up on that a little bit more. What else? What else you guys got?
I know we don't have football, but from like maybe like dad or whatever, like what do you think about like the new technology helmets? Like,
I don't know if there's. I mean, if you're gonna get hit, you're gonna get hit, and the helmet's gonna protect you, yeah. But there's no concussion-proof helmet. You know, the helmet's technology is better, and it's probably gonna help out in terms of reducing it. Is there gonna be a significant amount? I don't know. You saw those vicious hits. You know, I don't know what the hell's gonna. The only thing that's gonna protect the player from taking a vicious hit like that is a rule change, a culture change. Oh, really?
every time you get hit, either we have a human or a but they're not like.
Yeah.
I mean, so upgrade my content.
Yeah, right. You didn't prevent one. I can just pick it up, maybe. And that's at the NFL. Colleges, maybe some of the bigger D1 schools could afford that. The smaller schools won't be able to afford that. D2, D3, no way. High school, no way. Pee wee. I mean, football's massive. Sport's massive.
The football attendance is going down.
Is it? Yeah. Yeah, I'm not too surprised about that. Yeah. I would think, yeah, I think even lacrosse too. Lacrosse concussions are pretty, I don't want to say common, but it's definitely a significant, men's lacrosse, it's a significant injury. Just in my town alone, my daughter plays lacrosse, but it's women's lacrosse, which is very different from men's lacrosse, or boys lacrosse at that level. But their numbers are down and women's lacrosse numbers are up for whatever reason, and it could very well be from the contact, and we don't want that. The kids that come in more contact increase the risk for, I mean, the brains are still developing. They develop until 27, you know, and damage to the brain at a young age is going to, you know, have lasting effects for sure. Anybody else? None. Not one. Except for the kid in my first year in 2009. He had a concussion, but I think, yeah, he got a concussion, but I think it happened before I actually took over the team officially. But, yeah, he was the only one that had a concussion, which is weird because Kofani has really bony elbows and you like to swing them. Surprised he didn't get any more people. Yeah, basketball's the one with the least out of all my teams that I had. I had more dance than I did in basketball. Maybe don't play hard enough. What else? Nobody else? All right, well, if you think of anything, these guys know how to get a hold of me. Email, whatever, and I can certainly answer whatever questions you have. So, thanks for coming with us. Yeah, no problem. No problem. Oh, you guys been looking at those pictures?